Hello, everyone. As part of our collaboration with Baylor St. Luke Medical Center in Houston, Texas, we are pleased today to interview Dr. Sayed Feghali, the Director of the Coronary Care Unit at Baylor St. Luke, and the Clinical Associate Professor in Internal Medicine and Cardiology at the Baylor College of Medicine. Dr. Feghali was born in Beirut. He attended medical school at the American University of Beirut, then moved to Houston, Texas, for his cardiology fellowship and international cardiology fellowship. Dr. Feghali is board certified in cardiology and interventional cardiology. He's a fellow of the American College of Cardiology. He has been named a Texas Super Doctor since 2005. Hello, doctor. Welcome to our series of interview.
Hello.
How are you? So
Doing great, thanks. It's my pleasure to be with you.
Great. So in our series of interview, we usually shed light on the latest news about coronavirus and its impact on different category of patients. So today we are going to go through COVID-19 and heart patients and the impact of COVID-19 on cardiac patients. So my first question, doctor, is how COVID-19 affect the heart? And we know that people with heart conditions are at a higher risk of serious complications. Can you tell us why?
Sure. I'd like to start by reminding everybody that COVID-19 is a SARS virus, SARS, which means it's an acute and severe respiratory syndrome. So a lot of the damage and a lot of the problems that we're going to face with this pulmonary and the complications where it's related to the heart or other organs in the body are determined by how the virus to start with. So most patients that have the virus are, as we know, asymptomatic or have very minimal symptoms, possibly low-grade fever, the symptoms like a cold. And in a minority of these cases, this condition progressed further to higher temperature, respiratory problem, and then further complications. Mm-hmm. And we know that in these sicker patients, patients can have heart complications. They have a history of heart problems, or they were healthy prior to that. So the way I look at the complex issue of heart complications of COVID, I like to divide them in three groups, three levels, similar to a pyramid with three levels. So the first level is the most common, but the least specific. This is what affects most people with the COVID virus, is the heart is basically an innocent bystander. It faces, it recognizes what's going on. It has to work harder because there is an infection. It has to pump more blood. At the same time, there is less oxygen supply to the heart, which is the fuel of the heart, because of the respiratory problem. So that's what creates this mismatch between demand and supply of oxygen to the heart. And even if the heart is perfectly normal to start with, that can cause some injury. And the injury could be minimal, showing as some minor arrhythmias or mild elevation of the heart enzymes or in the blood. Or in the more severe cases, it could be a full-blown heart attack or heart failure, or even a state of shock. So that's the more general level of heart involvement. The second level of the pyramid is smaller, but it's more serious. And this is where the heart is particularly and specifically targeted by the virus. And so how can that happen? And we see that in the, of course, the more serious cases of COVID, the higher temperature, patients have low oxygen level in their blood, they have big infiltrates on the X-ray in their lungs, and the heart can be affected by what's called an inflammatory storm. This severe inflammation in the lungs, drop oxygen level, releases a lot of inflammatory proteins that are very deleterious to the well-being of many organs, including the heart. At the time, get the reaction of the immune system in the body that is very potent, very strong, and that reaction that we will cover, I believe, in a little bit further, create also some challenges and issues to the heart. So again, in this situation, we see a lot of heart, we see arrhythmias, we see heart failure, we see drop in blood pressure. So this is a more targeted level.
Yeah.
Then we get to the top of the pyramid, with the smallest group, but the sickest group, and this is the cases we hear and read about, which are young, healthy people, never had a heart problem, and all of a sudden they're having a massive heart attack. And this is a situation where the virus could, theoretically, we're not sure yet, but the virus attack the heart directly and cause inflammation and destruction of tissues in the heart itself.
And
The
doctor,
second part,
do you think it's due to the amount of virus that someone get affected with, or why some people get more sick than others? I mean, for the
right,
healthy people, not for the heart patients that have already heart problems. I mean,
right. So if we're talking about body healthy, young, and great physical shape, how can they get this amount of heart complications and damage from the virus? It goes over two issues: how severe the lung damage and complication from the virus, because the heart, the lungs work in tandems. It's basically two organs in one. The lungs provide the oxygen, the heart has to pump it. So it's not in medicine that if a person has a respiratory problem, they're going to have an associated heart problem. We know this for a long time, the influenza experience, where patients come in and the more serious cases will have heart complications. So just the bare involvement of the lung in a serious way will affect the heart, but also in young people specifically and in children, we have the stress, the importance of the immunologic response of the body, which is very strong in these young people. And so we have a very powerful immune system facing a virus that has never faced before. If we think about it in our daily life, every day we're surrounded by all kinds of pathogens, bacteria, parasites, and the immune system in the body over history has adapted how to face any one of these conditions. With this coronavirus, it's facing a new enemy, a new pathogen, and particularly in young people, its reaction to the virus has been immensely aggressive and strong, and by itself has caused a lot of the problems in these young people by releasing inflammatory factors that are destructive to many organs in the body. So it's like a self-destruct button that once it's initiated leads to serious complication that can cause major illness and death. So this is the issue with young, healthy people, different than the complications we see in the older population that have some risk factors, that have some health condition. That group, low immunity or reduced body response to the virus becomes a major issue. So it's diametrically opposite than what we see in young people. And these are the people that when we talk about giving plasma or to give antibodies to help their immunity, that's the patients with multiple risk factors and older patients.
So how a heart patient should manage his illness during this pandemic? So we know, we heard that some medications are doing are worsening the cases of coronavirus when someone gets the virus. So is it true? Or what do you advise people with the heart diseases? Should they discontinue their medications? Should they seek help with their doctors? What is your opinion on this?
Yes, that's a very important question. This is the conversation I have with my patients every day. The first part of the question, what is the heart patient going to do to survive this pandemic? And I think the more educated the patient is, the more in charge the patient is, the better they are going to do. So I advise them to continue on a very regular schedule of good diet, of exercise, indoors or outdoors, to be exposed to the sun at least 30 minutes a day, to breathe fresh air, to take their medications regularly, to maintain a certain relationship with their doctor, to ask and see if the doctor is seeing patients, are they doing visit through media, through the phone. So in case there is a problem, the patient knows how they're gonna approach their physicians. Next, we come to medication. I advise patients to have enough medication supply of their medication for at least 1 month, preferably 2 months, and also to avoid being isolated. Every patient needs to have an advocate to make decisions for him or her if things really get serious. As far as the issue of some heart or blood pressure medication making the virus worse, I like to cover that. It's a little bit complex situation, but I'll try to simplify it. Each cell in the body has receptors on its surface, including the lung cells, and these receptors are gateways and hubs for proteins or viruses to interact with the cell. So a virus, let's say like the coronavirus, cannot just penetrate the shield of the cell. If it's gonna go inside the cell, it has to go through a hub or gateway. The gateway it happens is called the ACE receptor, ACE, angiotensin converting enzyme receptor. So that's how the virus enters the pulmonary cell. Well, it happens that that same portal, that same receptor is found in other tissue like blood vessels, like the heart, and it is very important receptor in regulating blood pressure. And there is a very common class of blood pressure medication that more than 50% of people taking blood pressure medication will take, called ACE or ARBs. And these medication work on this same receptor. So there have been concerns, how is the interaction of the medication with the virus? Is it gonna facilitate its entry or it's gonna actually fight it? And studies have been done, and it has been clearly shown that the medications are safe. Patients don't have to worry that taking their blood pressure or heart medication is gonna make the virus worse. It does not. Actually, there are studies being done now of giving similar intravenous medication to sick patients with the COVID virus to see actually their health fight the virus. Of course, this is in a hospital setting.
Okay, great. So it's a good news for heart patients. They should stick to their medications and stick to their routine.
Yes, exactly.
Yeah. So, and doctor, what is the role of the immune system in protecting individuals with heart diseases? I mean, should they do something to boost their immune system? Maybe take some vitamins, or maybe they should go out in the sun, sports activities, or.
In regard to the immunity of the system, as we said, the immunity of the system is like the defense system of the body fortress. So it's a very important system. And really, the things that help the immune system, if they are elements we've been telling our patients for a long time that help general health, good wellness, similar measures for the yearly respiratory influenza season. So yes, you want to eat healthy. And in our community, particularly in the Middle East, that means fresh produce, cutting down on carbohydrates, cutting down on sugars. And so, so that regular activity is important. It doesn't have to be extreme, hard exercise activities. It's just walking, doing things, can be done indoors if the person cannot go outside under these circumstances. Fresh air is important. Exposure to the sun is important. So vitamins could help, although it's never been proven that the similar vitamins that some of us have prescribed for common colds or prevention of colds, will work in this situation also.
Okay. So, and what about the impact of the masks on heart patients? We know that the mask, it's one of the things we should do to cover ourselves from getting the virus. But some heart patients, they have a problem with respiratory, the respiratory systems. Do you think
Right.
masks are a must?
I think masks are very important. I think it's especially for heart patients because they are at a much higher risk of having complications with the virus. But the patient has to find the right mask that doesn't feel like it's causing suffocation or difficulty breathing, whether it's made of composite fabric or cloth. And but I do understand that if the patient has advanced respiratory problem and a lung problem, they're not going to tolerate a mask. In that case, you know, they have probably to be more careful about contact with other people and cover their face with the cloth if they're really in an elevator or any situation where they're facing other people. But I will try different kind of masks and see if they will be able to store one of them.
So, and how can coronavirus increase health problems in patients with heart failure? And
Yeah,
also, what should they do to avoid getting the virus?
you know, heart failure is a very hard problem. If we think about any heart condition that we deal with, in its advanced stages, it will lead to heart failure. So when we had a patient with heart failure, it's a patient that's older and a patient that has other risk factors for the virus, such as advanced age, diabetes, high blood pressure, kidney problems, possibly respiratory problems. So these will be among heart patients, the highest risk patients. And the reason is when they are stressed by the virus, their heart might not be able to generate the extra heart blood output that the body needs. So these are the patients that has to be the most careful about a good diet, medication program, of being in contact with their doctors on a regular basis, because also the symptoms of the virus and the symptoms of decompensated heart failure can overlap and be similar. So they could be actually having a decompensation of their heart and be misdiagnosed initially as a COVID case.
Yeah.
So my advice to them, you have to be on a very regular schedule. You have to have an advocate. You have to listen to your symptoms and don't ignore symptoms. If you start feeling short of breath, have low-grade fever, if you have any general weakness, tiredness, you really need to check with your doctor and have at least a virtual visit to see if you need adjustment in your medications early in the game before you have further complications.
Mm-hmm. So, doctor, we know that fever related to COVID-19 plays a role in increasing the pressure on cardiac muscle. So, can you explain to us what is the role of fever and why it has an impact on the heart muscle?
Uh, Fever plays a multifactorial role in this condition as well as in any active infection. So as we know with this virus, most cases will have no fever or low-grade fever, less than 38.5, and most of these patients will recover in a few days. Now you have few patients that the temperature then escalate to higher levels, 39, 40 or higher, and this becomes a different kind of patient that many cases will require hospitalization. So the first role of fever on the heart is any active infection associated with fever will require excessive oxygen demand in the body. So the heart pumps 2 to 3 times as much blood in that situation as at baseline. So that excessive demand on the heart, you know, can lead to stress and injury, especially in the older population. But also the high fever in this particular situation is a signal and an indicator that the case is moving in a more serious level where there is release of inflammatory proteins. And these inflammatory proteins release can directly affect the heart and cause heart injury. So that's why after dealing with this virus for a few months right now, when a patient presents with suspicion of the virus, there is a panel of blood tests done to see if there is an active inflammation. We check things like C-reactive protein, like sedimentation rate, to see if there is any sign of active inflammation in the blood. We also check the heart enzyme to see if already there is some minor damage. So high fever in these patients definitely single out a higher risk group.
So, Doctor, through your observation with the COVID-19 patients, are heart patients are more likely to die from the coronavirus, or what is the percentage of risk?
Unfortunately, I have the answer is yes, and we have solid statistics regarding the coronavirus as well as the influenza virus. If you have significant heart problem, your risk of the virus is 5 times higher than the average population. And patients that die from the coronavirus have on the average 3 risk factors. And I'd like to spend a minute talk about risk factor. There are 9 major risk factors, and the way I look at it, one factor is not modifiable, which is advanced age, and we're left with 8 modifiable factors. High on that list is heart or cardiovascular problem, a history of cancer, especially patients that are undergoing chemotherapy or immunotherapy presently, and respiratory problem. So that's already 4 risk factors. Then we have a group of what's called metabolic factors and plus smoking. So metabolic factors include diabetes, high blood pressure, obesity, chronic kidney problems, and then the smoking issue. So the problem that patients face, especially in the more advanced cases that we're talking about, like heart failure, is they have additional extra risk factor, as we said, diabetes, advanced age, hypertension, kidney failure, they could be smoker. So that risk multiply. And that's why I'm not saying this to scare heart patients, but for them to be aware that they are really singled out as a very high risk. They have to be careful, they have to do all the precautionary measures, but at the same time, they have to fit with their family, they have to be connected with their environment and feel that they are in charge of their destiny.
And what do you think about the study that was done in France concerning the nicotine protection against coronavirus? They were doing a research on this. I don't know if you are familiar with this.
Well, I've seen a lot of different, I mean, we're throwing everything at this virus, and we start with a logical premise that this particular mechanism can affect the virus in that way. I don't have personal experience with nicotine in that situation, but it's worthwhile doing a focused study, see if it's helped. There's hundreds and hundreds of agents presently that's being tried, so we'll see what happens.
So we know that people with heart conditions are advised to get the flu vaccine every year. Is this still stand during this pandemic, and what are your recommendations?
Well, we have tremendous experience as cardiologists dealing with complications of the flu every year. And we know that in the United States, the flu virus, in spite of having the vaccine and antiviral medication that works for that particular virus, that 60 to 80,000 people die every year from the influenza vaccine. So we understand clearly that vaccination, at least for high-risk patients, is important with influenza vaccine. I think it's going to turn out the same situation with the corona vaccine, hopefully when we have it, hopefully that's coming soon. And I think the same patient is considered high risk for both viruses and should be vaccinated against both viruses.
And doctor, are cardiac patients treated the same way as the healthy people? I mean, when they get the virus, what are the treatments available for heart disease patients?
That's a very good question. There has been discussion that there is some, initially, at least initially in the experience with the virus, some of cardiac care and patients with heart problem. Part of it related to the fact that patients were scared to come to the emergency room, to come to be admitted, worried about catching the virus. But also, what we have learned is all the standard uh, procedures we do our patients when they come with an emergency, whether it's to do put a stent in a blockage, do heart surgery, any intervention that we do on these patients in the age of the coronavirus, the risk of these procedures, if the patient has the virus, is the complication is much higher. To say that in this age, we're somewhat more conservative in treating these patients with heart complications in the hospital and avoiding procedures unless they are absolutely necessary. But that's why it's important for the patient, if they're having symptoms, don't delay, come to the hospital, contact your doctor right away to see what can be done. Because also, as I mentioned, there is some overlap between symptoms and its advanced cases and symptoms of heart problem.
Mhm. So we heard a lot about a second wave of coronavirus. Are we still in the first wave? Are we getting a second wave soon? What is your
Well,
opinion?
I tell you, it's been very interesting with this virus that any moment we feel we have good understanding of what's going on, we get humbled by some new event. So what we are still in is the first wave of the virus. The second wave is supposed to happen the coming fall. And there is also some major discussion all over the country, all over the world for that matter, if this uptake and spike in cases now is due to the fact that we opened businesses too early or the virus is mutating in different forms. It's now attacking younger people. It's somewhat milder cases. So I think we have a lot to learn about this virus still.
Mhm. And don't you think that the death rate is a sign that the virus is getting weaker with time, or no? It's irrelevant.
Well, again, if you listen to the virologist experts in this field, they caution being complacent about feeling that the virus is less pathologic and milder. And one concept we have to think about is the virus has attacked the most vulnerable people already. The people in terms, the very elderly, people in their 80s, 90s. So it has attacked and caused a lot of damage in that group. So possibly now it's attacking the younger people. Virus has mutated in a form that's less virulent and not yes, the number of deaths is decreasing, but as in proportion to the number of cases that are tabulated. But we cannot relax with this finding because it can turn around at any time.
Mm-hmm. And doctor, what are the chances of getting an effective vaccine in the near future? And do you think people should immediately get the vaccine or no?
Yeah, that's a very good question. As you discuss the vaccine with different people in different circles, you hear different opinions of educated people whether they will receive the vaccine or not. I hope the vaccine will come tomorrow. Everybody is talking about possibly before the end of the year or early next year. I think the sooner the better. But as far as who should get the vaccine initially, I would say that high risk patient, as we went over and covered today, should get the vaccine very early in the game. Someone that is low risk might decide to wait to see what kind of complications the vaccine has. Um, so they might, if they're not totally convinced that they want to take the vaccine, they might wait a little bit. But high-risk patients should get the vaccine right away.
Mhm. And doctor, what are your advices to people suffering from, at the end of this interview, what advice do you give to heart patients all over the world, especially in the Middle East?
I think, yes. I think we have a lot of heart problem in the Middle East, and that's why I go back to tell every patient to think about these risk factors and get familiar with these risk factors, because the risk factors for the coronavirus are the same risk factors for any challenge you are going to meet in your lifetime, whether it's elective surgery, an infection, emergency surgery, any stressful situation on your body is gonna be determined by where is your general health situation at. And so we have been telling patients for years to work with these modifiable risk factors. If you smoke, don't smoke. If you're overweight, that's a good time to start thinking about a diet. If you don't exercise, start exercising. If your diabetes is now well controlled, please go ahead and get it controlled. Same with blood pressure. So all these principles not only are important for present virus, but they are important for the well-being of any heart patient or any person in general. And the more time and effort we spend on modifying these factors, the better it is for our well-being short-term and long-term.
Mhm. So great. Thank you, doctor, for this informative interview. And I hope next time we'll be talking about something else. We will be getting through COVID-19 soon, and maybe we'll talk about other issues, heart issues. Thank you very much for your
Inshallah, it will happen.
time. Hopefully. And hopefully we'll see you in Beirut also.
I'm looking forward to it.
Thank you, doctor.
Thank
Bye.
you.
Thank you.
Bye-bye.